Great, thank you. And as I think you probably just heard, the recording notification, today's webinar will also be recorded and made available on the Momentum and other partner websites afterwards. So you can go back and reference it or share it with any of your colleagues who may have missed today's webinar. As we go throughout, please do put questions and comments into the chat, and we'll address them at the end. So you can put them in as we go, and then we'll revisit them at the end. So again, today's webinar is focusing on strengthening FP and SRH emergency preparedness and response. We'll have a short presentation at the beginning and then a panel discussion afterwards, and hopefully about 10 minutes at the end for questions and answers. Today is the first of a series of webinars that are being co-hosted by Momentum Integrated Health Resilience, PROPEL Adapt, and FP2030. My name is Christopher Lindahl. I'm the Deputy Director for Learning, Knowledge Management, and Strategic Communications for Momentum Integrated Health Resilience. These webinars are going to focus on sexual and reproductive health preparedness and resilience, and deep dives into emergency preparedness and resilience for SRH, spotlighting its importance in continuous access to SRH services during crises. In the run-up to ICFP in 2025, we're planning this series of exchanges on this topic. And so please keep an eye out for those. Future topics might include things like readiness assessments, tools to support preparedness and resilience, and youth-led EPR action. To finally get us started with the actual content, I'd like to first introduce Oren Jusu, who's going to give about a 10-minute presentation before we get to our panelists. So Oren is the FP2030 Emergency Preparedness and Response Director. He's based in Nairobi, Kenya, and supports all of the FP2030 hubs. He's a humanitarian practitioner focusing on response preparedness and relationship building in humanitarian contexts. In the last 14 years, he's established his skills in providing strategic humanitarian support to country teams across sub-Saharan Africa through preparedness and relationship building. He's worked at various agencies, including Tier Fund, IRC, Action Against Hunger, and Mercy Corps. Oren, over to you.
Your microphone is off, Oren. You have to turn it on. Good.
Thank you, Chris. Hello, everyone. I'm really so glad to have this opportunity to discuss with you FP2030 preparedness approach to advance right-based and voluntary family planning in emergency context. As some of you may know, FP2030 works with many countries across the globe to advance family planning. And these countries have signed a commitment to really advance family planning in their own countries. Next slide, please. However, when we step back and look at almost all of those countries that we support, we realize that they are vulnerable to shocks and stress. And these shocks and stresses, this vulnerability could be related to hazards that are related to conflict, armed conflict, as we see in Africa. It could be in West Africa, it could be in East Africa, and some part of Southern Africa. The fragility could also be related to pandemics or epidemic, as we have seen just really come up from the global pandemic, the COVID pandemic. And this vulnerability could also be related to extreme weather, as it really resonates very well with Asia-Pacific region, and of course in Africa and other parts of the world as well. And because of this, we have also seen a decline in terms of biodiversity. And this is why we step back at FP2030 to see what can we do to help countries to advance preparedness. And when you also talk about fragility, fragility has no boundary. It doesn't know whether the country is underdeveloped or is a developing country or a well-developed countries. As we can see, even in the US and well-developed countries, we have seen cyclone, how disastrous they can be. So FP20, because of all this, FP2030 has stepped back and strategized to work with countries in order to enforce preparedness as it relates to SRH and family planning. Next slide. There have been studies that have come out with some fascinating reports. And this really outlined the importance of preparedness, because what happens with emergency is that they exacerbate the existing vulnerability or gaps that exist in countries. So they estimate, this study estimate that that of any population of it states that at any population, 25% are childbearing age. And the research also said that at any given time, 4% of any displaced or disaster-affected population will be pregnant. So let's take, for example, we have 1 million people displaced. We may have 40,000 of them who will get pregnant. And out of this 4%, 15% will definitely experience pregnancy-related complications. And these complications may lead to death. And most shocking, around 60% of preventable maternal deaths occur in those contexts. And 45% of newborn deaths occur in countries affected by recent conflict and natural disaster. Ladies and gentlemen, we can make a difference, because the question we need to ask ourselves is this: do you think those women who got pregnant in emergency context made an informed decision, or they got pregnant because they lack information on SRH and family planning and services as well? If we work around countries to build their preparedness and ensure that they are able to provide family planning information and services during emergency, we can save this death. We can change things around. Next slide, please. Yes, emergency is a really game changer. Preparedness, sorry, is a game changer. Preparedness does not only prepare us for the emergency, but what it does is also helps us to strengthen existing health systems. It really builds the resilience of communities, but also the health system to bounce back from stress and to be able to respond. Why do we need to invest on preparedness? Because very often when we talk about preparedness, we talk about preparedness in traditional humanitarian context, where we provide wash, where we provide food, where we provide other health services. But we don't normally talk about preparedness as it relates to SRH and family. We have to do this because all countries we work in are vulnerable. I've just presented the previous slide. And also the benefit of preparedness, it also helps to strengthen existing health system. It does not only prepare us for the emergency, but it helps to strengthen the existing health system. It also allows for quicker response. The more we invest in preparedness, the faster we are able to respond and the more efficient we are able to respond, and we can save life in time. Next slide, please. Therefore, at FP2030, we have a strategy. And the strategy talks about the main goal. And the goal is family planning access is maintain and improve for women and adolescents affected by acute and protracted crisis. The goal is not only looking at women who are caught up in protracted crisis, but also in acute crisis. For example, in Nairobi, where I am in Kenya, I think every one of you might have seen that on the news. There were flash floods where livelihoods were lost, but even lives were lost. So we also look at acute, but also we also look at protected crisis. We provide technical support to countries to be able to respond in case of acute or protected crisis. Next slide. In order to really attain the goal, we have set 6 main priorities. One is around EPR, around the commitment themselves. Like I mentioned earlier, with all the countries who work, they all have commitment. And some of these countries have already included emergency preparedness in those commitments. So what we do at FP2030 is we provide the TA support that those countries need to be able to implement the commitment that they have. For new countries that are making their commitment, we help them to reflect back on the fragility of that country and include EPR. We also broke up technical assistance and also finance to countries that we work with to be able to advance the EPR agenda at the country level. When you look at the family planning and SRH space, we mostly talk about, when we talk about data, it's more about clinical. We talk about the intake of stock, but no one is really talking about measurement. We are not more talking about measurement in terms of preparedness. Now the conversation has started, and FP2030 is also joining various international organizations to look at ways we can also measure preparedness as related to SRH. And then we also want to influence global and national EPR agenda. As you know, preparedness is not something that is known even among some donors. So we want to ensure that not only at the national level, but at the regional and global level, we want to influence EPR discussions. We want to also broaden the FP20 partnership base and to break down silos so that we work in coordination to be able to advance EPR. And of course, in terms, we also want to advocate to see that more investment is done in preparedness. And in doing this, we work mainly with youth at the country level, at the regional level, and at the global level. Next slide, please. In order to drive the 6 priorities I talked about, we have our Center of Excellence that is based here in Nairobi. And the Center of Excellence have 4 key offerings. One is foster cross-country and cross-regional learnings. We have realized that a lot of countries are doing a lot of good job, but how can we ensure that other countries learn from to be able to advance their own EPR agenda at the country level? But we also bring the regions, for example, Asia Pacific, how can they learn from the East and Southern African region in Africa, or maybe sometimes how they can even learn from the Northwest and Central Africa region. We also build coalition and synergy with key EPR and climate change. It is very evident that the effect of climate change has a negative consequences on SRH and family planning, especially affecting women and girls. So we also want to advance building coalition with all of these actors, climate actors, the humanitarian actors, to advance preparedness to SRH. We of course provide technical assistance to countries to be able to advance the implementation of their commitment at the country level, and advance the national, regional, and global preparedness and response agenda. We also work with countries at the regional level, at the global level, but also at the country level, at the global level, and at the regional level to be able to advance the family planning agenda. We cannot do this alone. We have to do this with partners, and we are partnering with a couple of organizations. As you can see, this webinar is a partnership of a couple of organizations, including ourselves. Next slide, please. The good news is there is a momentum. We have seen a political buy-in from countries, and the momentum for preparedness is growing at country level. As you can see, the green is the countries that already have commitment, and they have included preparedness in their commitment. So they are about 75%. And we only have 25% of countries who have not included. But those countries have already started including the preparedness in their action plans at the country level. Just a snapshot of countries who have made bold commitment. Kenya said they want to incorporate family planning services as part of the essential service package during disaster response. So the momentum is building at the country level. We have a political buy-in in many countries to really advance preparedness, so, which is a good news that we all need to build on to advance preparedness as SRH. Next slide, please. Thank you so much for this opportunity. And I will look forward to any questions and I'll be able to answer. Over to you.
Thank you. Thank you very much, Oren. Thank you and good morning, good evening, good afternoon to everybody. I'm Nazreen Talbi. I'm the Emergency Preparedness and Response Consultant for FP2030. And I have the honor to moderate this panel discussion. So I'm really pleased to facilitate this important panel discussion focusing on emergency preparedness and response commitments made under FP2030 and learning about experiences and strategies used in different countries to really secure continued access to family planning and other SRH services during emergency. Please note that this panel discussion will be in English and French. So make sure that you have selected the right channels because it will go from one language to another. Today we have three esteemed panelists from three different regions, Burkina Faso, Bangladesh, and Ethiopia. All three countries have made commitments with FP2030 and have included emergency preparedness and response as part of their commitments or have included it in their costed implementation plans. So let me start first by introducing my colleagues. I will go west to east. Tout d'abord, laissez-moi vous présenter Wendiam Micheline Caboret.
Wendiam est une activiste he's an activist of human rights. She's a feminist, committed feminist. She's a communist feminist and executive director of the Panane Tugri initiative for the well-being of women in Burkina. It's a feminist organization, and thanks to women's strategies, she's also working for a more equalitative world, respecting women's rights and gender inequality. She also works for development extensively. It's a focal point for society. For one of Udus and IPN. Thank you for being with us, Wendiam.
Experience of more than 16 years. He holds a PhD in public health from the University of South Africa and a master's in public health from Addis Ababa University. He has worked at an FPA Ethiopia country office for the last 10 years on the humanitarian preparedness and response program, focusing on SRH in emergency programming and the integration with QBV prevention and response. He manages multiple programs and provides technical support to humanitarian actors on SRH in humanitarian programming. He co-leads and coordinates the National SRH Technical Working Group, but is also engaged in health cluster coordination and other coordination platforms. And finally, Professor Dr. Abdul Halim from Bangladesh. So he's the director of the Reproductive and Health and Child Health Unit of the Center for Injury Prevention and Research in Bangladesh, which is a research-based NGO. He has been engaged in research since 1990. He served for the last 35 years in OBGYN, and of which 25 years in the government sector and later in private institutions. He is the author of multiple publications, over 60 actually, and teaches obstetrics and gynecology at Kumundini Women's Medical College. Thank you very much for our three esteemed panelists. If you want, and if it's possible for you, you can go on camera now. And let us start by understanding how your country has included emergency preparedness and response strategies at national level. Commençons par vous, Wendiam. Pouvez-vous nous dire un petit peu quels sont les engagements?
Can you tell us what are the experiences in Burkina Faso in FP up to 2030? What are these commitments of Burkina in as far as preparation and planning, and to guarantee access to family planning, but also sexual and reproductive health in case of emergencies? Thank you very, very much, Nasreen. Good morning, good evening, everybody. Good afternoon. Thank you for giving me the opportunity to speak to you and to all of you listening to us from all over the world and following the conversation. I just want to speak about the commitments of Burkina Faso's commitments within the framework of responsiveness to health planning, family planning, and reproductive and sexual health in the midst of crisis. We have a current crisis, we all know, and unhappily, the security crisis, this enormous causes many distortions and many traumas, many stresses, and has a lot of impact, a big impact in terms of protection of women's rights and girls' rights. And thanks to there's a lot of studies and research, the crisis increases and exacerbates sexual violence, specifically with a big focus on women. Most women are victims of sexual violence, and this crisis has deteriorated the quality and especially the access to health services in general, but mainly sexual and reproductive health in terms of family planning, especially. We have to say, though, that Burkina has signed a commitment for FP2030. The main commitment that I'm going to talk about is the commitment of an available, unreachable, and accessible network with available service and available high-quality services for the population in the midst of security crisis, with a mechanism for preparedness and a more effective resilience mechanisms from 2022 up to 2025. So it's a commitment signed and adopted, and thanks to this commitment, there was a whole process which was implemented, and there were several actions to have a better response to the needs of these girls and women, to be able to be fully aligned with the needs of sexual and reproductive health. The activities we carried out in case of the implementation of these mechanisms in Burkina was helped by very important technical and financial partners we have, women's defense or women's defense organizations and civil society organizations, accompanying different cases for the implementation of the response plans and resilience plans. So we do have strategies which have had an important impact that cover the 6 regions under crisis, which were implemented by the state, by the government. These strategies, we can realize about the different services which were developed. For example, the creation of a plan, of a family plan, of a community family plan in the 6 regions where there is security crisis. There was also a formulation of the health agents or partners to improve quality of care of the victims, and another focus on family planning. I'm going to go back to our experience as an organization of civil society. We also provided material and material for health structures, especially for those that have. We implemented a mobile service to better reach the population. It was more than 2,600,000 people were displaced or internal refugees. So at least 6 regions have a big security crisis, or a stronger security crisis, where there was a lot of population which were highly impacted by health services, education services, support services. There were lots of mobile services which were deployed nimbly to offer services, especially reach to contraception, family planning, and so on. Also, providing support or regular provision of materials and kits for family planning for these for these mobile centers, so that they were not, so that we didn't interrupt, or so that these services weren't interrupted. Of course, the strategy is not enough. We have to understand that access to these regions is very difficult. So all these comprehensive strategies are implemented to offer these planning services and to provide post labor services after birth, and contraception and planning services, and civil society partners and organizations that work in the humanitarian dimension, they offer services as well. These organizations also offer training and support for care, for better care and attention to these needs, because women are victims of an increasing amount of violence. There's a lot of rapes, family violence, domestic violence. So these are urgent needs, and they need this service. Sometimes health units in place don't have necessary material to face these problems. So we need these partners which offer kits, or maternity kits, family planning kits, and kits after rape, after rape, to help and to improve the services. We also have awareness programs, awareness raising programs to accompany the implementation, safe spaces for people to go and speak out, safe places to accompany these health agents in the implementation of the functions. Oftentimes, the security conditions don't allow optimal. Thank you very much. Very interesting. It's very important to see these commitments and the progress the great progress in Burkina. Michelle, could you tell us about two major challenges, Michelle, that we still are facing, that need special attention? Yes, absolutely. I could tell you that there's lots of challenges, but if you want me to pick the most important ones, with the current situation of Sahel's country, with the exit of some partners, there is a big financial need, a big financial crunch or vacuum, because Burkina, you see, it adopted the free contraception. So we're distributing free contraception, and the consumption, or the intake or consumption rate exceeds supply. So we have a financial crunch, or vacuum. We do everything so that Burkina continues full monitoring and giving them out free. So the problem is first security and resources. So we've advanced. Well, of course, we've guaranteed, we've improved guaranteeing security in the where the government has been able to, but we still have many other danger zones where we cannot have access, and sometimes these services don't reach these populations that are so vulnerable. And organizations, besides those that are in the humanitarian realm, help. It's very difficult for other organizations or classical organizations to provide support where there is a humanitarian or security crisis. I believe that these are very important points, and I hope that we can discuss this further. Let me give the microphone to Dr. Halib. Dr. Halib, you're with us?
So from a Bangladesh perspective, so let me ask you a similar question. What FP2030 EPR commitments or other processes has your country done to really secure access to FP and SRH during emergencies, given also that we know that it's a country that is particularly prone to natural disasters particularly. So it would be interesting to hear from the experience from Bangladesh and its engagement with FP2030. Thank you. You are muted.
Your microphone is off, Dr.
Can you
Abdul.
unmute?
Sure. It's okay. Thank you so much for this privilege. Bangladesh, as you know, that is very much prone to the disasters like the floods and cyclones, and every year these affects us, and the zones and other things are almost the offshore area, the near the Bay of Bengal, as well as the lowland of Bangladesh. And it's a devastating floods, you can say, the cyclone, tornado, whatever you say. And all the health system become disrupted. The people communication become disrupted. For that, every year we have to face this similar type of service actually, and also needs, and as well as including the food, all those things, livelihood services. Whereas if we think of the SRH and the family planning services, this is also the key and demanding agenda for the country program. That's why the government identified this area as the very much high priority. And our sector program, which has been passed in this 23, and the new one is upcoming. During this period, actually, some of our development partners, some of our actually the national government institutes, NGO and others has collaboratively worked under a government framework of SRH the group, the SRH group, or Emergency Preparedness and SRH, these groups. And they have actually conducted some assessment as well. And the assessment rightly identified, and also some NGO-led assessment also identified the need of the maternal health services, need of the referral, need of the increased incidence of the gender-based violence, addressing those things, and particularly the family planning commodities. The supply chain become disrupted. Some of the facilities go underwater, so the hospitals, the health post, everything is really need to be actually sorted out and to do this one, for which government under the sector program, they have actually identified FP 2030 commitments, the government commitments aligned to the improvement of the SRH and FP through an integrated multi-sectoral human right-based approach, targeting leaving no one behind, and preparing action plans. And that's why actually the working group actually preparing the action plan, and that is in 5 years plan, and then upcoming the sector plan of say 23 to 29, so 2029. So that sector plan actually has got those activities, what has been identified during the process of assessment, the SRH need assessment for the emergency and climate disasters. And that areas has been rightly identified and incorporated into the sector plan, and for which government actually identified the DG family planning, which is responsible for the SRH, and also DGHS. The focal point is the DGFP in collaboration the DGHS and the DG nursing and midwifery and other partners, development partners, to update the action plans or align to the national action plan, the framework to implement the activities when the disaster come up, and for which the collaboration at the sub-national level is very important, for which government take this initiative to issue all the government orders and communicate to the local levels, not only the health, non-health sector as well, so that the immediate response can come. And within this framework, actually, UNFPA has a great role, and other partners like the World Bank, they are working with the other part of the DGHS, if it is a pandemic, if SRH and the FP, then the family planning. So they combinedly works at the sub-national level and implement all these activities. So the sector program already identified all those things under actually the health program, and the priority and actions identified into 5 headings like this. The activities has been identified through workshops at the national level at the end of 2023. The emergency preparedness and response plan. So they identified the area for this one. They identified what to be done for the coordination. Coordination at the national level, at the sub-national level. What should be some capacity building activity, training activity. And that's why they have identified those areas as well to build the local level capacity so that they can respond immediately. They can respond right away. So ensuring the uninterrupted supply which is really a big issue, particularly while these areas are really poor area, there needs the supply things that's for the maternal health care, like ANC service materials, the ANC, PNC delivery. So delivery places are lost in the flood. So they need a place for this one. Some studies have been shown that about 7%, the last year to district study, this is only 7% delivery could happen in the facility because the facility was not prepared at that time during the study period, and 19% of people got 4 ANC only. So you can understand the condition of the mother, how they are suffering during this disconnecting environment by the cyclone and the preparedness. So for this one, actually implemented activities, some of the experience for CIPRB with the UNFPR, we have done some local level capacity building activities under Defeat Better Health program, where we have actually taken some study and the needs, and based on the need assessment, actually we develop some curriculum. So the local elected members, local level people, the non-medical people, non-medical social, civil society actually organizations, they can have the capacity, how can respond this SRH area. So focusing the SRH needs and the gender-based violence need. So the capacity building of the non-health people, also the health managers, and particularly the midwives, particularly the healthcare providers, to train how they can respond this one. So they can work very simply. This is one activities, and in continuation this one, and also in another disasters, you might know that the northeast Bangladesh 3 districts has been flushed last year, 22, which has been a devastating one, and everything is drowned and then disrupted. And then UNFPA with the actually SURF or the EF Emergency Fund project, humanitarian project, they have actually through the CIPRB, we have given the MISP services, minimum service package for the maternal health, ANC, PNC, the delivery, as well as the secure as the gender-based violence counseling and referral of the cases, by which we can cover. Not only that, we have also supported those people for the financial things. As you know, the financial, this barrier is not less. It is very much and supply of logistic, and also upgrading those broken health facilities, and also making some sort of community-based awareness program, because as you know, these areas are really always vulnerable. These people are a little actually ignorant about the all the needs and other things, and what to do or not to do. So these are really important to do. And another work recently, the REMEL, that one also we are planning. In addition, we are thinking to execute some mobile health camps participated by some doctors, some nurse midwives, and also the volunteers, so that we can organize in the remote statist area, the area which cannot be approached, so that we can give some services for the just post REMEL cyclone affection, and then another 6-month continuation to have the livelihood there. So these are the activities what the Bangladesh government is doing under their sector program with their partners, and like all the NGOs and civil societies and the non-health organizations. I think
this is really, really interesting. And also, I mean, what just came out of what you were saying is like really the need for collaboration at subnational level, the cross-sectorial approach, and really also ensuring that there is this community engagement. I think these are very interesting approaches. Let me come back to you just in a few seconds, because just in a matter of managing the time, let me just also bring on our colleague from Ethiopia. So Ali Maihu, I'm hoping I'm saying this correctly. So you are a humanitarian expert, and you really work directly also on the field in humanitarian response. We know that Ethiopia has made a commitment with FP2030. EPR was not very present in the commitment as such, but has been included in the costed implementation plan. So what do you see? So what are these engagements that have been made? what do you see as progresses, and where are still like bottlenecks that need to be addressed, particularly in a context like Ethiopia, which has been where there were humanitarian crises, natural disasters, and where actually you have to respond to humanitarian responses regularly. Thank you.
Are we not sharing the screen? Just a question from the master. We're not sharing any screens, right?
Correct.
Good.
Thank you. Thank you so much, Nasrin, and hello, everyone. As Nasrin rightly said, Ethiopia is having a complex humanitarian situation because of conflict, drought, flooding, disease outbreaks, and others. And based on the 2024 government-endorsed humanitarian response plan, 21.4 million are in need of humanitarian assistance.
Remember to speak slowly and clearly, because we're doing translation.
I think it is audible. So based on the government-endorsed humanitarian response plan 2024, 21.4 million people are in need of humanitarian assistance. And we have also 3.2 million internally displaced persons. And the country is also hosting more than 1 million refugees, mainly from South Sudan and Somalia. Of these affected populations, UNFPA estimates that more than 7 million are women of reproductive age group, and more than 1.1 million are pregnant women, and of these, 15% or 170,000 of pregnant women are expected to develop pregnancy-related complications that require emergency obstetric and newborn care services. So most of the subnationals or regions, we call it regions, are highly affected with these complex emergency situations. So as part of the UNFPA's intervention, as well as commitment with the government has also endorsed 7 years family planning costed implementation plan, 2023 to 2030, with a budget amounting of 513 million USD. Of this, 65% is allocated for commodity security, in which we are working closely with the government to ensure that the supplies are part and parcel of the emergency response too. And as part of the family planning costed implementation plan, it is envisioned to increase contraceptive prevalence rate from 41%, the current we have based on 2019 Ethiopian demographical survey, to 54% for all women for all married women. But we have a very huge regional disparities. Some regions are having very, very low contraceptive prevalence rate that belongs to even 3.5%. And there are some regions which is having contraceptive prevalence rate of more than 50%, in which the country is trying to work its narrowing down the regional disparities and ensuring equity and access to those populations which is lagging behind on contraceptive prevalence rate. And this costed implementation plan as a policy guide includes the humanitarian response as a commitment for the provision of family planning services in humanitarian setting. Another policy or process in which we are working also to ensure SRH family planning in humanitarian setting is we have the 4 years National Health Sector Development and Investment Plan, 2023 to 2026, that also considered inclusion of SRH family plan services in humanitarian setting as one of the strategic initiatives. That is, this initiative is mainly supported through 2 major thematic areas. One, Ministry of Health with its lower structures at regional, zonal, or Kabyle levels are working on capacity development on health supply chain management. And higher institutions like Addis Ababa University School of Public Health is also working on training material development as well as pre-service training that will ensure supplies provision, not only for developmental programs, but also addressing to those complex emergency affected populations. The third policy we are having and also working closely with the government to enhance the government's commitment is the co-financing or compact, in which the government is showing an increasing commitment in everyone, which shows that the government is taking ownership and contribution for the commodity security. And before this compact or co-financing is signed off, more than 95% of the supplies is covered through donors. But now, since last year, or because of we have two different Ethiopian fiscal year and Gregorian calendar years, and last year, the 2016 Ethiopian fiscal year, that means mid-2023 to mid-2024, the government committed for 5 million or 15.6% of the total requirement of 30 million USD for family planning, reproductive as commodity security. And for this, the new Ethiopian fiscal year, 2017, that means mid-2024 to mid-2025, the government committed for 6 million from the total requirement of 35 million that covers 17.4%. That commitment really, we believe as UNFP and SRH partners believe that this commitment will ensure supply sustainability and addressing the humanitarian needs and improve this integration, because there is a silo between developmental and humanitarian programs. So it is narrow down the silos and increases the humanitarian development necessary programming through integration. As part of progress on emergency preparedness and response actions, UNFP and SRH partners ensured SRH family planning key areas of intervention with the government endorsed humanitarian response plan that really helps us for advocacy work as well as resource mobilization for ensuring SRH family planning interventions in humanitarian setting. Moreover, in collaboration with the Ministry of Health and sectoral bureaus at lower levels, we are able to develop emergency preparedness and response for SRH or family planning in humanitarian setting guide, which has been developed, reviewed, and approved by the Ministry of Health, and we are really now working on its dissemination. And considering this approval of the humanitarian emergency preparedness and response as part of family planning SRH in humanitarian setting intervention guide, we are also developing a detailed implementation guide for its action orientation or action taken at lower level to be implemented at grassroots level, including service delivery points. UNFP has also conducted with missed readiness assessment with SRH technical working group, and now we are taking actions based on the technical working group agreed action plans of the missed readiness assessment results.
Thank you. I think this is just, let me jump in because it works well with one of the questions that is in the chat, what you just said about these assessments that you have done. So one of the question was, what have been really effective strategies to ensure that preparedness activities are also monitored and that they also inform response actions? This is a question that we received from one of the participants.
Okay, thank you so much. As part of the effective response strategies, we always engage the government as to take buy-in and ownership, as well as to continue the program implementation. For example, we have an active SRH technical working group coordination platform that's being conducted at national level and in selected areas at sub-national level. So in that regard, the government is taking the lead and UNFP is co-chairing and facilitating its coordination platform so that the government is taking action as part of the commitment as well as part of ownership for taking the assessment result findings. Because one of the issues we are found in the assessment for missed preparedness assessment is, like other, I believe that will be also applied for other countries, because like Ethiopia, which is having every year millions of populations have been affected by emergency, we are having low interaction or low engagement, especially on terms of preparedness and availing supplies in pre-positioning, because we are always responding to the emergency affected populations in which we don't have any sufficient resources for preparedness as well as pre-positioning. So on that regard, because of the engagement we are having with the government is also allocating and considering some budget as contingency planning for emergency preparedness and response too. So we always engage the government, not only at federal level or national level, but also at subnational levels too.
That's really interesting. Thank you. Thank you for, I'm seeing a lot of questions coming in. I'm trying to respond to as many as possible. I mean, take on board some. Maybe here's one, maybe for Dr. Halim. Because with your research background experience, it asks what percentage of preparedness actions have actually been put into practice in the event of an emergency situation in your country? Do you have, is there like data on that available about the percentage of preparedness actions that have also been translated in the event of an emergency situation?
Actually, thank you so much for the question. Very interesting, because this is the experience for me with the UNFPA-led emergency preparedness.
Could you turn your camera, please?
Oh, thank you again. So it's all right. So this is actually an experience through the UNFPA actually led some activities where the government was the key and the other partners were there. So we have done some area services like this, what I said, the northern eastern flood flush, where the 3 districts has a population of a huge number. All these services has been distorted and it has been decreased to very little because many of the facilities gone underwater and many of the facilities, supply chain has been really cut off because the central district level was also disconnected from the divisional level. And also the team HR cannot stay in around the union facilities, sub-district level facilities because this is drowned or something like it. So how the ANC can be given and other things. So the data in the sense, the services has been decreased to about 2 to 3-fold less than the normal service deliveries. And the complex, I have said already few data regarding the actually the ANC prevalence in those areas, about 19% or so for the 4 times ANCs during that flood times. After effect flood time. So this has to be restored by giving those, what can you say, the mobile health services and also reactivating the facilities, refurbishing the facilities and deputing extra midwives in those areas, a project from the UNFPA fund. And also giving fund for the volunteers to bring those people, costing the referral and other things. So for referral of even the emergencies, so those can be, those also has been taken care of. So this made some sort of, what can you say, around 4,500 mothers has been actually referred to the higher facilities for their some sort of prolonged deliveries or other complications or cesarean sections. So also the patient to bring back to the home. So these things are really a number which is reflected through those short term. And the compliance to this sort of emergency services for the community, that was by qualitative study has been proved to be very much fine. And also the actually the community, the people, they have agreed that the incidence of gender-based violence has been increased. About their report is really so big. The assumption like this, about 80-70% girls and young people, the adolescents are actually abused some way physically and also by other way. And about the women actually interviewed, among those around 50% plus in the Gaibandha and Shatira study by the actually some other research study has been shown that they have been experienced some sort of gender-based violence during the last previous the previous disaster time. So this is really indicating that this calamities gives a what can you say, upset of the health system, access to the services, also the vulnerability of the young women, girls, all everybody to the gender-based violence. So
yes,
this to be taken care of.
I think, thank you. I think this is, I mean, this is a lot of super interesting data. And also, I think that there is still also additional research and the link between preparedness and response also to be able to document this properly is really important. Let me ask a last question from the audience to my colleague Wendiam. Wendiam, vous êtes toujours avec nous? Ce sera la dernière question, et si vous pouviez la faire relativement courte.
Can you talk to us a little bit? We have a minute and a minute and a half. Could you please tell us? Can you expand on what are the specific needs of women and girls in the zones impacted by humanitarian crisis or others, and what is it that would work best to increase access to these services? Can you give us shed some light on your experience? Thank you very much. Yes, about the women's needs and girls' needs for these health services in the zones where there are security crises. The needs in terms of contraception what we see linked to rapes, increasing rape levels. We need to increase care, a more holistic or comprehensive support, and a mental, social support is very important. How should I say this? In terms of care, special care during labor or in periods of childbirth, big challenges during childbirth and during labor or childbirth. Because under crisis, you see, there's actions that can respond to specific needs, and there's big challenges. We need to increase awareness raising. There's areas where there's no complete services or comprehensive, there's not effective presence. For example, let me give you an example of the project that we're currently developing. We're in a place in Pinganga to the east of Burkina, and in that location, very, very, very poor. Other villages around, there's no very difficult access, and to go these distances, 7 kilometers, 10 kilometers, 10 kilometers to go to the closest center by foot. And the current security conditions, it's an ordeal to move towards the service. So that's why these mobile services are super, super useful to reach the population. These mobile services sometimes cannot physically move. So we have logistics issues, provide supply chain and basic products and stockouts. So we have a lot of stockouts. Or the roads are blocked or access is not. So we have lots of challenges, especially in availability of products, stockouts, and access to services. But in the field, but all organizations that are working here and cover this are working. We're working on better on additional donations and kits and post-rape kits, and also medical material that is offered to these health centers to have high quality care and services, and training of agents to do effective interventions during emergencies. They are trained to intervene in case of emergencies, to be able to care and take action to protect these people that have been affected, especially these women and young girls in terms of reproductive health. Thank you very much for your experience.
There are a lot of questions we haven't answered to yet, so it shows that there is a lot of interest. Maybe we need to do a follow-up. We'll try to answer to all the unanswered questions, so my apologies if we didn't go to that one. Let me thank my three esteemed panelists for all your very valuable input. I think this was a really interesting discussion. And let me hand it over to my colleague Sarah Rich, who is the Deputy Project Director for Fragile Settings and Resilience on the PROPEL Adapt project, for some very short and quick closing remarks. Thank you, Sarah.
Thanks, Nesreen. And yeah, thank you to the three panelists. It's exciting to learn about the progress that's being made in this area, and in particular, how it's being operationalized. So thank you again for sharing your insights with us today. We wanted to share a couple of resources where you can go to learn more. One is the FP2030 website where you can
Are you
find more
sharing?
about-
Yeah, we're not seeing your screen.
I'm
We
not
will
sharing
be-
the screen. Thank you. So one is the FP2030 website where you can go to learn more about the commitments. And we've also shared from Lorelei the Interagency Working Group on Reproductive Health and Crises website, or the IWAG website, where you can learn more about work that's being done to advance access to SRH in crises. And lastly, we wanted to remind you all that this webinar is part of a broader series that's being co-convened by Momentum Integrated Health Resilience, Family Planning 2030, and PROPEL Adapt. The webinar series focuses on emergency preparedness and resilience for SRH and FP. And some of the other topics we'll be covering throughout the webinar series are progress on implementing the MISP readiness assessments and some of the FPRH preparedness tools and approaches that you might be able to, that you can find. So please stay tuned for more information about these webinars in the coming year. So thanks so much again for joining us today. We'll share these resources. We'll share the recording from the webinar today, and we look forward to continuing to engage with all of you. Thank you.
Thank you.
Thank you so much.
Thank you so much. Bye.
Bye, everybody.
Thank you, everyone.
Thank you.
Au revoir. Au revoir à
Au
tous.
revoir. Merci beaucoup.
Merci à
Merci.
tous.